And thank you for joining us once again this Monday evening on the PM Express. Remember, the hashtag is hashtag PM Express. Hashtag PM Express. My handle is @Nuete. And so feel free. That's NUETEY. But most importantly, don't forget to use the hashtag PM Express. And there's a lot to talk about today. A lot that affects lives. Because as we have learned tonight, schools are on lockdown. Senior high schools have been placed on lockdown. They were supposed to go on midterm breaks, particularly the Form 3s, the last year group. They're supposed to go on midterms up until the 26th of July. That is not going to happen anymore because the Ghana Health Service has advised the Ghana Education Service that we need to manage that process. Why? Because of the rising cases of COVID-19. And as we heard tonight from WACPIC, the head of WACPIC, Professor Gordon Awandare, the third wave is here now. The third wave is here now. And on this show, it was predicted we are approaching the third wave. He says categorically that it is here. And so on the back of that, a series of actions have been taken. And it's affecting education. So I know a lot of parents who today called us to say they were expecting their children back home after a long period at the senior high school preparing for an exam. They were expecting them back home for tomorrow's holiday, and they've been told tonight that the children will not come home. Why? Because of COVID-19. We are getting rising cases of COVID-19. And as we know, no students can go home for the midterms. In Kumasi alone, which is becoming a hotspot for the Delta variant, the KMA issued a statement today in which they tell us that they've had 10 people die in 13 days. 10 people die in 30. This is in Kumasi alone, right? And it's the same region which is hosting an emergency health experts meeting. We're going to get into the details of what the meeting had decided today because the health experts have been meeting in Kumasi. A very important meeting indeed as we begin to handle this third wave. A few things to observe. We know that Ghana has recorded more than 1,000 cases of COVID-19 in just 2 weeks. This is pretty alarming to note. Now we have 812 people dead as a result of COVID so far. As of July 14, 2021, 812 people have died out of COVID. And we know that the Delta variant is the one that is becoming really troublesome to handle. We know that 27 persons are currently in severe condition, 12 patients in critical condition. We have an active case count of 2,800 plus. So listen, we had a second wave just around January, February, and in March it sort of began to die down. And the health experts began warning that listen, we are approaching a third wave, which is possibly going to be the worst wave yet. Tonight, as we speak, we are here on the third wave. I want to take you to the dashboard for the Ghana Health Service. That gives us a breakdown of what the situation is currently. Listen, we need to appreciate where we are so we can take this seriously. But the Delta variant, very deadly to those who are unvaccinated. And as we know, majority of Ghanaians are not vaccinated because we've struggled to get a vaccine. And so we cannot take this for granted. Our only option is to observe the protocols. Now, here is the dashboard. Currently, confirmed cases is 98,000. And note that this is heavily understated because you can only know your confirmed cases if you are testing enough. And by all stretch of the imagination, we are not testing enough. And so this is what we know. So you can fairly say that this 98,000 is heavily understated. It's just very conservative. We have 95,000 recoveries, very good. But the deaths, 812. If you compare to other parts of the world, you say, well, but this is not a big deal. Well, compared to what we have in terms of the health infrastructure, we cannot contain it. Our health system will be crippled if we allow this to go on because it will be overwhelmed. Other countries with bigger health infrastructure have been overwhelmed. So if we don't get this under control, we'll get overwhelmed. And that is why this is important here. We know the new cases, 382. This is alarming. It used to be in 2 digits or daily cases, sometime in the 20s, 30s. Now we've grown to become, we have a new case of 382. The count is serious. The new cases active, as I've just indicated, is that in the regions, Greater Accra is leading, followed by Ashanti, which has always been the story. So let's get into the details, because there's a lot to go through. We want you to have the full facts. But at the end of this, we want you to be serious with the protocols, okay? I'm delighted to say that we're joined by the Ghana Health Service head, Dr. Kuma Bwaje. I'm grateful that he's joining us, Patrick Kuma Bwaje. Also joining us is Dr. Michael Owusu with the KCCR. We'll also be joined by, of course, Kwame Sapanasedu, also joining us. And of course, Dr. Yaberiaku is joining us also. I want to start with Dr. Patrick Abwaje because he's the head of the Ghana Health Service. Dr. Abwaje, thank you very much for agreeing to talk to us. I mean, I really don't envy you at all. We are having these conversations so people can appreciate the gravity of where we are. So I don't have anybody in the studio, but I'm wearing my face mask. We need to send a message out there that we are in a critical period and people need to take this seriously. So please help us. First of all, where are we tonight with our COVID situation? Kindly please unmute for me. Sorry, we still can't hear Dr. Abwaje. Okay. Doc, I think you're still on mute. Okay, we still can't hear. We still can't hear him. But of course, I have a whole host of guests. Doc, can you try again? Let's see if we can hear you. Doc, we are still on mute. I can see on the screen that you're still on mute. Your screen says you're still on mute. Okay, you can talk now. I can hear you.
Hello.
Yes.
Yes, it was the host who had blocked me out.
Okay. Thank you very much. We have done that now. Thank you very much.
Thank you very much.
Yeah.
Well, I thought you have already created your own situation of the status in terms of the numbers and how stated they are. But anyway, what we have is currently over 98,000. Our most current figure, which has been published, the active case about 3,140 and not 2,885, with 115 deaths so far. That is where we are. We have rising cases in Accra and Kumasi. I say Kumasi because the other districts around is quiet, but it's Accra, Kumasi Metro and the rest. And also in Accra Metro and the surrounding area, that's where we are having the increasing number of cases. We have had a significant number of clusters that have also shown outbreaks. And these are in some workplaces. These are in a couple of few schools, Accra, and a few schools in the metros in Kumasi. That is fueling the number. But of course, there's also some community spread increases across the country, and it's something that we are all working towards to ensure that we are back away.
So let me ask you down the back of the wave question. Tonight, I spoke to the good, respected Professor Wandari, on the back of the decision that was taken by the Ghana Education Service, and I asked him the question, is a much predicted third wave here now? And he was very emphatic that we are in the firm grips of a third wave. Is that your assessment too?
I wouldn't say we are already in a third wave. If you follow our trajectory very well, there's always, we have some humps, sometimes they are better, sometimes it goes on when there's a trigger. And that is why we are here to do an assessment in Kumasi to see our situation, not just in Accra and Kumasi, but all over the country. Where are the threats coming from our neighbors, etc., to take decisions. I wouldn't say, yes, we have an increase. We could avoid a wave, but if things continue that way, we may move into a wave. But if you look at our epic very closely, you see that there's always a little hump, and sometimes it abated and sometimes it continues. That's why we had the 2 waves. And so you need to study the trend very well. But we are looking at it. And I don't think that anybody is wishing away on us. We've always been prepared to control the any outbreak. And that's exactly what we continue to do.
I know today yourself and other health experts who have been meeting in Kumasi. Have there been any firm decisions on the back of that meeting yet?
It's a 2-day meeting. We haven't finished. This is something we do every 6 months.
Okay.
But this particular one is also to ensure that it has coincided with the timing that we have an increase. And so we take stock of where we are, look at what strategies that need to be maintained, what needs to be improved, how do we prepare for any eventuality, how do we prepare for vaccination. There's a lot that we are discussing here. And I think tomorrow, after lunch, we should be able to give a fair assessment of what collectively we have decided.
Let me bring your colleague experts into the conversation. Dr. Bediako, let me start with you. I mean, it was your boss who told us tonight clearly on my show on radio that as far as he's concerned, where we are now, we are in the firm grasp of a 3rd wave, and that he's sounding that caution so that we can enhance the protocols. You do agree based on your own, what you're seeing from a professional standpoint?
Yes, in this case, I'll have to agree with my boss. I think we are in the beginning of a 3rd wave. If you look at the data, we have daily new cases that we haven't seen since March, and we know that March was the end or around the end of the 2nd wave. So having about 328 new cases. If you look at the graphs, if you look at the data, we haven't seen that many new cases since March of this year. So we are at the worst points we've been since March. So certainly, and if you look at the trajectory of the curve, it continues to go up. I think a wave, we define waves after they happen. So I don't think we should necessarily get into splitting hairs about whether it's a wave or it's not a wave. We have a significant surge of cases. Now, typically a surge precludes or is part of a wave. So I don't think whether it's a wave or it's a surge or it's an increase, the bottom line is we are seeing drastically higher number of new cases per day than we have seen in a while. And the last time we saw these levels, it was the tail end of the 2nd wave. Of course, in that wave, we hit as high as 800 cases a day. We have not yet got there. So let's, I agree with the Director General that if we can avert it, if we can spread this out, if we can flatten the wave, as it were, the curve, then we may hopefully not hit those levels, because those levels become very problematic for our health system. So there is clearly a surge. A number of us were predicting this with the emergence of Delta. And so we are, numbers are going up around the country. We are talking about, clusters in Kumasi and in Accra. We are seeing cases in schools. In the first, let's remember in January, and of course, schools were not quite as open, but we didn't see such large outbreaks in schools. We are seeing more involvement of schools in this wave, which fits with the characteristics of Delta, in that it appears to cause a bit of some symptoms in younger people. So we are in this is a serious situation. Whatever we want to call it, whether we are not quite ready to call it a wave or we call it a surge, whatever be the case, it was never gone. Many of us never said COVID was gone, but if you thought COVID was gone, it's definitely back. And I think that is what I would encourage people to take from this, is that we need to get very serious. We need to treat it as seriously as we've ever done.
Let me ask you, because you are with WACPIC, with this increase in numbers, how much of it is attributed to the Delta variant? Because the sequencing, what's the latest sequencing telling us of the predominance of that variant?
The sequencing is telling us that Delta is growing in its is growing in its predominance. It's not yet the only variant. South Africa currently has reported that 95% of the cases they have sequenced are Delta. Ghana is not there yet. We are still getting a number of alphas, when we sequence, but we are seeing Delta gradually overtake, gradually take hold. We are not yet, in January when we were sequencing, alpha was almost 100% in some parts of this country. We have not yet seen that in the samples we are sequencing, but we are continuing with cooperation of Ghana Health Service and the Ministry of Health, we are continuing in our sequencing efforts. We are sampling from hospitals, from test centers, from the airport. And so we will get more information as it goes on. Right now, the data we have from samples taken in May and June, I think probably 10, 15, maybe 20% of them were Delta. We've not yet got to the point where you're over 50 or 60%. We are still picking up other variants. And you can see this on the dashboard that we have put out. But certainly there is a trend that Delta is becoming more predominant. And it's a worrying trend because of what we know about Delta. And certainly the surge we are seeing, the increase in cases, fits what has been reported elsewhere, that when Delta, which is a highly transmissible variant, enters the country, you begin to see expansion in number of cases. And that is what we are seeing in Ghana. I
mean, Dr. Kwame Sophonisadu, I mean, you are in the UK. Today, UK is celebrating a day of freedom because they're so happy with the vaccination they've done, and they can open up the economy fully, drop all the restrictions. But relating that to Ghana, I've heard Dr. Patrick Kumabaji and of course Dr. Bediako. There's some hope they give me that we can, if we do the right things, we can flatten this curve that we are beginning to see, which you experience of the way COVID has behaved, especially when the Delta variant enters. Is this optimism grounded? I mean, should we be as optimistic?
And thank you, Evans. Yes, I would say that based on what Dr. Abaji said and what Yabi Diako just said, we should be optimistic on the basis that we comply with the protocols. If the compliance remains what it is, we need to be extremely pessimistic. And I'd explain why. Even in the UK, where we've opened up today, the guidance that those of us working in the area have received, it's clear that we have to be cautious and we should encourage people to wear masks and use hand sanitizers in close environment, on public transport, and even in open spaces when they can. So if you go into a pharmacy, if you go into a GP surgery, if you go into a school, if you go into practices, they are wearing it. What has gone away is the mandatory requirement or the legal guidance, which means that if you don't wear it, you could be prosecuted. But that doesn't mean that the protocols have gone away, because what's happening in the UK is that the cases are going up. In fact, like you see in Ghana with Delta, the current caseload in the UK is around the caseload in February, March. Today, there were 39,000 new cases in the UK. The only difference is that in February, March, when there were 39,000 new cases, you saw 2,000 deaths on average. Today, there are 39,000 new cases and you see 17 deaths, 20 deaths. That tells you the power of the vaccinations. The other thing you're seeing is that of those who've been doubly vaccinated, between 25 and 60%, depending on which hospital you are looking at, are getting symptoms, and some are getting hospitalized, but they are leaving hospital very quickly, which is in line with what vaccines do. That ideally, they should prevent you getting, a lot of people say, when you are vaccinated, you cannot get infected. And I'm using the UK data to dispel that, and we need to dispel that pretty quickly, because I think that is driving part of the irresponsible behaviors where people are not complying with the protocols, especially when they think they're vaccinated. People are still getting infected when they are vaccinated, because that's what vaccines do. They help your immune system to fight off the infection should you get vaccinated. But when you have reached herd immunity, because there are so few people to be infected, then they break the transmission chain as well. UK is seeing that in the population over the age of 50 years and in the nursing homes, because when people are in nursing homes, it's a circulated environment. Everyone is over 75, 80 apart, and their carers and all that are vaccinated. But even then, they are still using the protocols. So we can be optimistic if we can quickly drive up compliance. But if compliance is like what I see, based on what I see on social media, then that is where I'll deviate from what Dr. Abuaji said and say that, like Yao said, the 382 was the lower part of the end of the second wave. It probably is the signal that we are hitting the third wave because we've hit the lower bit. And if we don't comply with the protocols, it's only going to go up. So whether we are going to be optimistic or pessimistic depends on us and what we do in the next 5 days.
I mean, that's so critical. Dr. Michael Wusu, pick up on that for me. I mean, you are in Kumasi, and we are seeing the Kumasi story in Accra. It's pretty dire. I watched the Metropolitan Assembly issue a statement today, very concerned about just the breakdown of the observance of our protocols in Kumasi. And they paint a very dire picture, funerals, parties, etc. People have just simply lost control. I mean, but you are in Kumasi. Tell me, why is this happening? Although we're seeing so many deaths in Kumasi, for example.
Yeah, Evans, this is quite worrying. So for us at KCCR, we're monitoring the data since June, 1st of June. Within the first week of June, we're seeing about 5% of community cases being positive, sometimes 1%, 2%, or 3%. Second week of June, this rose to about 10%. Third week, we're around 20%. Currently, we are doing about 40% of community cases that come to the facility. I mean, even among travelers, I mean, we used to have 1 out of 100 cases in the first week of June. But then, I mean, for travelers who don't have any signs or symptoms, now, as we speak now, it's almost about 10%. So, I mean, most of this is about the way people behave. They don't believe COVID exists. They think that it is something that people have coined a story around and something that the Ghana Health Service wants to use to deceive the population. So this mixed feelings of people not believing something exists is what is driving the complete disregard for these protocols, both within vehicles, sometimes on funeral grounds, at parties, at churches, and many other places. It is difficult convincing people to just put on masks. Even on funeral grounds, when you tell them to put on masks, they just don't want to care. And you know, in Kumasi as well, I mean, funerals are one of the heavy things that is so much, integrated within our culture. So if people don't believe a virus exists and you tell them to put on masks on funeral grounds, they wouldn't just do it. And this is where I think we need to really work on. I know that the Ghana Health Service has made several public educations. The Public Health Directorate has talked about this over and over again, both on radio, but then people just don't want to respect these protocols. And it is very difficult convincing them to do so.
I mean, Dr. Abuaje, I want to zero in briefly on the school situation, because today you issued you almost warned the Ghana Education Service that they plan for the break should be amended. And they acted very swiftly to your advice. I want to talk about a bit more of that, because I know there are parents who are tonight, will not have their kids back home because of that. We need to touch on that and the situation in our schools. But I want you to stay with me, all of you, very brief. I want to take a quick break. When we return, we'll deal with that, because I know there are many parents who want to hear what this means for their children and when they can expect them back home. And why are the authorities saying they can't leave although they have a break? Stay with me. For staying with us here on PM Express, we are talking about this increasing cases of COVID-19. And as you know tonight, many parents have been left disappointed because their wards aren't coming home. They were billed to go for this break for midterms, but on the advice of the Ghana Health Service, the Ghana Education Service has decided that the midterm breaks should not happen and that the schools should simply stay at the schools. And I'm delighted that I have all the men who understand this to help you understand why they had to take the decision they've taken. Dr. Patrick Kumabwaje is, of course, the head of the Ghana Health Service. We also have with Dr. Bediako with the WAPIC, and they have been doing a lot of work in terms of the sequencing. We have the KCCR's own Michael Owusu, and of course Kwame Sapansedu with the CDD fellow. Dr. Bwaje, I know there are many parents tonight who will be feeling disappointed because their children are not coming home. Why were you compelled to issue that advice to the Ghana Education Service, which calls them to also then ask that midterm breaks as planned should be suspended and keep the kids in school?
I know you said that the schools are on lockdown. Please, they are not on any lockdown. It's been part of the protocol. And if I explain to you, I mean, if you look at when school reopens, the first 3 weeks, you always have issues because people are coming from all places and some of them are positive, and it takes about 3 weeks for them to settle. And so currently, with the increasing number of cases, we felt that it was better that they spend their holidays in school so that they don't come back and lose more time trying to fight the virus, because the chances are that when school reopens, they are going to come from home and some will come positive. And so yes, like we did the other semester where there was no break, it's the same way that we are encouraging that they should not, because this time even the environment is a bit more riskier than before. So that's the reason why we've advised that they take their holiday in school and not say. If you look at the Achimota case, about 5% of the day students who we just strategically tested were positive. And so that tells you that
we may have a challenge with
it. That we are breaking the protocols. Parents are not supposed to come and visit. They allow them to visit. They were supposed to go to dining hall in groups. They did not do that. And so once they started the congestion and breaking all the protocols, we saw the outbreak of the cases. So that's why we are trying to encourage that for this period, in order for them to come back and prepare for the exam, in order not to lose time trying to fight the virus, it's better they stay. And it's good that the education service listen to our advice.
How do you deal with the day student factor?
Well, the day students always remain, any school that is mixed has a challenge. What we do is ensure that the protocols are significantly upheld. They are coming from the house, wear their masks, and so they come to school, they wear their mask. The danger is when they go back to their dormitories. That is where they don't wear masks and there's a spread. And so the day students, they are on holiday, they'll stay, but when they come back, we are looking at other ways, depending on the current situation where they're coming from. We are looking at the possibility of some limited screening when they come back before we can continue. I mean, that's always a relatively smaller number than the boarding house students.
I mean, I noticed in your advice to the Ghana Education Service that you did advise because you also quote, it may also present challenges to containing existing outbreaks in schools. What's the situation with the outbreaks in schools currently?
Well, we had the Achimota one that has been resolved. We have a few schools in the Ashanti region where we've had some mild outbreak, which is also being resolved. It was clearly non-adherence to the protocols, which is being resolved. Some of them are being contained here, and some are separate dormitories. Some of those who need some care is being isolated. And currently, the region is dealing with it, and the numbers are going. I think we have a few active cases still left, but we have to encourage all to ensure that they abide by the protocols. And that is what, because in school, because the large numbers, one student with a Delta variant can spread very, very fast to a large number of people. And that's why we are having that. It's not a whole outbreak across the country. We have about 4 schools in Kumasi, in the Central region. And then we had one, Achimota, one, which is there. But if the trend continues, we may have outbreak. And so we want to start ensure that they abide by the protocols and we have all the necessary settings that allows for containment of any outbreak in the schools. And so we don't want a situation where they will come back and you create a situation which usually happens when school reopens afresh. It takes about 3 weeks before they settle.
I mean, Dr. Bediako, should we enhance testing in our schools? Should we increase testing in our schools on the back of what is happening?
I think, I mean, I'm happy to hear the Director General mention that they are considering certain amounts of sort of targeted surveillance testing among students, perhaps when they return, at least for the day students. I think it'll be important that we think about testing, because without testing, we don't know the true scale of the problem. So I think, as the situation evolves, I think it's important that we keep all options on the table, because perhaps sort of targeted, especially now that there are a number of antigen tests that have been approved by the FDA. I think it might be useful if we could use some of these antigen tests, which are much cheaper than PCR and can be deployed very quickly, to just do a sort of almost a random sampling in a number of our public schools, our big public schools around the country, to really just get a sense of what is the scale of the problem. Because many of them may not be symptomatic, but when you are not symptomatic, you also think that it's not a problem. But perhaps by doing this screening and just demonstrating the scale of the problem, it will communicate very clearly to people, that students in these schools, that they have to adhere. So till we have data, I think it's not about scaring people, but it's about demonstrating to people the severity of the issue. I think there's a certain complacency that has set in, not just in schools, but across the population. And I think perhaps doing some of these screening exercises where we demonstrate that COVID is all over the place, or it's not, whatever the data will show, would be a clear way to signal to people the need to abide by these guidelines. Over the break, I checked to see what proportion of our tests were Delta. In June, 20% of our sequences were Delta. That is a worrying trend. Delta is not a joke. So if in July we are now looking at 30 or 40, that would be an escalation. So there is cause for us to certainly take this seriously, and perhaps certain targeted testing might provide the Ghana Health Service with the necessary data to communicate to people clearly the need for stricter adherence to the guidelines.
I mean, on the back of that, Dr. Abuaje, let me ask you, do we know enough now in terms of the scale of the problem to put a bit more aggression in the approach? I'm asking that because isn't the possibility that our approach maybe is not aggressive enough because we don't know enough because of the testing we've done?
Well, thank you very much. I think you have to look across the globe, and just then you say that nobody is testing enough, nobody is working hard enough. I think the essence is to reduce the risk and also contain. And I think this is not just a health service responsibility. The larger response is how the whole population behaves. And but I believe that a lot is being done. Ghanaians tried a lot, especially in January, February, March. But it looks like everybody is just relaxed now. We can go back to that when we had about 50% of the people wearing masks, and we saw the decline in the cases. And I think we can do that, and I'm hoping that's what we do.
I mean, Dr. Kwame Sarpong, what's your comment on that?
Two things. I've always said, and both in public conversation and private conversations with Dr. Abuaje, I've always said one thing: testing is expensive. And so I always can understand when people are making decisions around testing in a cash-constrained environment. But I always just suppose it to where I live. I mean, in the UK now, testing is proactive. It's not reactive. So you go to your pharmacy, you can pick up antigen tests like Dr. Bediako said, and you are encouraged to test twice a week. My second son just came back from his prom. When he was going, he had to do an antigen test. He's come back to anyone who had to go for their prom when they finished school had to do an antigen test. They had to do one yesterday, they had to do one today. He's come back, and tomorrow and 2 days after, he has to do an antigen test because they've got tests at home. So you realize that you are seeing 39,000, 50,000, you think, oh, there are so many people infected with COVID in the UK. It's not actually true. it is because any Tom, Dick, and Harry is walking to the pharmacy shop, picking up antigen tests, and the testing is so massive that the numbers are coming in. And it is a good thing because then they can see the correlation between infection, hospitalization, symptomatic disease, and mortality. So they've got that level of data. Unfortunately, with the level of testing we are doing, like Yao said, we don't have that level of robust data. I mean, and I say this not because of anything, but I say this with context, because if you listen to Michael's point, he said that they are getting 4 out of 10 of all the community cases testing positive. Their positivity ratio is 40% then. Yao has then talked about 20% of the cases they had in June being Delta. I know, having spoken to colleagues in institutions in Ghana, I'll not mention names, that all of them are doing seroprevalence studies, and they are all getting 35% plus as the exposure rate in Ghana, which is in consonance with the positivity percentage Michael also just said. So if that tells me we are not testing enough, even by the WHO standards, and that cannot be put at the doorsteps of the Ghana Health Service as well, because the truth is they don't have the money to test. And that is why I'm saying that when you find yourself in this situation, when the data and reality don't agree, the only option is what Dr. Abuaji said, compliance. Because when you comply, whether the prevalence is 100% or not, if everybody is wearing a mask, sooner than later, within 2 weeks, it will all drop because the virus has an active run rate of about 10 to 14 days. So if as a nation, we can't be compliant even for a month, we can avert this third wave. It is not, and that's why I always use data to back the sort of things I say, because all we need is 14 days to 21 days of 60-70% compliance with the protocols, and suddenly will disrupt the virus. Because if you have an infection, you are infected for between 7 to 10 days, maximum 14 days, and we know that the data is there. So why don't we just do that? And that is how I'll take it from here.
I mean, Dr. Michael, what do you say?
Yes, so I think we've discussed this issue of testing in earlier stage of this first and second wave. But like we always say, if you have limited capacity as a country, I mean, one test is about $100. Even for the antigen test, it's not for free. It's still expensive. So if you have people who are symptomatic and are sick, your best bet to channel resources into testing these people to enable you to treat, to isolate, and to get them well. We have huge number of students, several across the country, even including tertiary students. If you want to screen all this population with your PCR, then you can imagine how much you will have to invest to be able to do this. And if you don't take care, I mean, we are gradually going to the peak point where people are likely to be more symptomatic. It will be a bit difficult if people are sick, are coughing, are sneezing, and they cannot access tests because these tests has been made available to large population of asymptomatic cases who may be well ordinarily. So the issue of balancing when to channel your test and then what form of test to use is quite critical in this stage. I mean, we started with about 2 tests, KCCR and Noguchi. Now we have about 40 testing sites. And I think most of them are looking at people who are symptomatic or maybe first or primary contacts of these cases. So we need to balance this in such a way that we don't overly use what is being sponsored by government for large populations of students to the point where we may risk when we need it most to attend to patients who are getting sick. And also be reminded that, I mean, for the 54 African countries, about 26 of them are currently in their third wave. So this PCR case you are talking about is gradually, the demand will increase. So to get to a point where even buying it from places like China, where you used to get it frequently, because of the increase in cases across the continent, you may not get it. So I think that, yes, testing is important, but then let us balance this with what is needed most. And for me, those who are critically ill and sick are the people that we need to really channel resources to, so that we don't have people coming to the hospital. We say there are lack of test kits. I think that we should be careful not to get to that breaking point. And therefore, decisions on this kind of test will have to look at carefully. And for me, channel it to those who need it most, I think is the best thing that we need to look at.
I mean, we need to have a conversation about vaccines because from everything I've heard from you experts, to avoid the third wave and the hospitals and health system being overwhelmed, it will take the vaccine intervention. And so, Dr. Patrick Agbaje, I guess the next big question is, where are we with the vaccine situation as of tonight? Because I guess it is our really ultimate saving grace, in addition to being respecting the protocols. I'm going to come to that shortly after this quick break. Stay with me. Thank you very much for staying with us. My guest is still Dr. Kumar Agbaje, who is the head of the Ghana Health Service, Dr. Bediako with WAPIC, and of course, we also have Dr. Kwame Sapwansidu, and of course, Dr. Michael Owusu. Dr. Patrick Agbaje, if you're still there with me, I mean, I think there's consensus on the matter that ultimately is the vaccines that will be our saving grace, as UK is showing us that it can actually open up, although their cases are going up, because they're confident and trust that they've vaccinated enough of their population and that they will not be overwhelmed in the hospital. So it begs the question, where are we with our vaccination campaign?
Well, thank you. I like the word we. I think vaccine diplomacy and accessing vaccine means that everybody must come on board, including the local media, to also make a case that not just Ghana, Africa needs vaccination. Yes, there's a lot of effort being made. Currently, we are expecting some COVAX supplies, hopefully by middle of August, or if not, end of July. We also have some donation from the US government. Government has also made deposits for another 17 million vaccines from AU. That may come in August or the fourth quarter. So those are the things that are currently we can talk about. But there are other efforts being made to secure vaccine as quickly as possible. We had a very good window when the second wave ended, and that we had opportunity, we had access to the vaccines as we were trying, would have saved us a lot more. But I still think that we might still be able to get vaccines to our labs. And fortunately, because we concentrate a lot of our vaccination in the hotspots, it has also helped a little bit in abating some of the cases, especially the people who are fallen sick and getting into hospitalization. You can see that even though the numbers are not going up, we are not getting as much hospitalization as we had in January, February, March at that period. And so, yes, this is what we have. But I think they have to be part of the global efforts to ensure that vaccines are made available.
I mean, the timeline you gave, it's mid-August, late July. I mean, so our best case scenario is late July. I guess it begs the question, with the sort of trajectory we are on right now, will that timeline save us from a proper third wave?
Well, I think even if you take a vaccine today, it may take about 2 to 3 weeks before it starts working. And so, vaccine or no vaccine, our best bet is adherence to the protocols. And that is what we all need to look at. And then the vaccine will come. The vaccine will save us, not just now, but also in the next few months, probably in the years ahead. But in all that, even the people who are vaccinated, who feel that's one of the problems, who also think that I'm vaccinated, I'm free. I think no vaccine give you 100%. And like Kwame said, until you're able to get a herd immunity, we're not going to cut transmission, especially when you have less than 5% of the population vaccinated. And so what we have now, we can do most now is our protocol adherence, whilst we also raise up to continue to vaccinate as many people. And I believe that if vaccines are available, we can still hit the 20 million before the end of the year.
Yeah, I mean, let me end on this. Let's be blunt about this. Kwame, let me ask you this. Really, you have any faith? Because I've heard we've circled back to the observance of protocol. With all that has happened over the last few weeks, with our leaders themselves leading by wrong example and breaking the COVID protocols in our faces, have we lost that conversation? Going back to tell people now to wear face masks and observe protocols, have we simply lost that conversation?
No, we haven't lost that conversation. And that's why some of us have been very blunt. I have occasion to hold someone like my own uncle, Dr. Siasai, to account for saying that funerals do not spread COVID. For example, I have been blunt to say there's no science to that. Because all the data I can see, there is correlation in closed spaces, there's correlation in open environments, and then there's correlation in crowded spaces where ventilation is poor, one of which is a football stadium or a funeral. So statistically, you cannot tell me that doesn't spread COVID. And if we can, all of us can hold people who make such statements to account and be blunt to them, then we wouldn't lose the ability, the moral high ground to be able to tell others that our leaders are doing it doesn't mean you must do it as well, because ultimately the disease burden lies with you. And I'll end by adding this. Last week, there was a research for 79,000 patients released in the Lancet, showing that even people who were not hospitalized, 45% of them were having organ damage. And that's 79,000 people. That's huge. That tells you that getting infected is not a roller coaster. And then finally, vaccines, forget it as part of our second wave strategy. Why? First dose, 22 days before you get optimal protection. Second dose, 14 days after. If the period between doses is 8 weeks, you are talking about 3 months. By that time, we'll be out of the wave. We need vaccines. I agree with Tabuaji. We need to all make noise for the global supply chain to open up. But the truth of the matter is, it is not going to impact in any way, shape, or form in us averting the third wave if we have to. What we do is the protocols. I'm done.
Okay, fantastic way to end. Listen, wherever you are watching us tonight in Ghana, don't lose hope because you've seen your leaders break the protocols. Take your own destiny into your own hands and observe the protocols yourselves. We cannot emphasize that enough. Dr. Kumawadi have said that the only way to win this and avoid the third wave is if you wear your face mask, you wash your hands, you use your sanitizers, avoid crowded spaces, and social distance. Do that, and we may well avert a third wave. Enjoy the rest of it, gentlemen, and thank you for tuning in.